Good afternoon, everyone. We are going to start this meeting today of the Homeless Prevention Board, and we're going to start with a roll call.
All right. Diane Fleet.
Here.
Amy Beasley.
Here.
Bruce Davis is excused. Liz Sheehan.
Here.
Amanda Bryant. Lella Still.
Here.
Chris Primo. David Shad. TC Johnson. Joy Andrade.
Here.
Billy Love.
Here.
And at this time, I'd like to introduce you to our newest board member, Ronald Delgado.
Here.
We'll go ahead and give Ronald just a brief opportunity to say a little bit about himself before we get into the minutes.
Good afternoon, everyone. First, I want to start by thanking you all for the service that you've done on this board and really telling you all my excitement to be able to be here with you all, discuss what really is a very prevalent, very pressing issue, especially as we see the winter months coming. As Jeff said, my name is Ronald Delgado. I'm a job counselor at Jubilee Jobs of Lexington, where I also coordinate all of our youth-facing initiatives. My area of specialty within the workforce development is really working with youth, individuals between the ages of 16 and 24. Naturally, a lot of our work, that workforce development intersects with other issues that a person might be facing. It is not atypical for someone that doesn't have a job or is unemployed to also be in pressing need of housing, pressing need of healthcare. And so understanding that intersectionality of issues is really why I'm here and really fuels my desire to be on this board. As I said at the beginning, I look forward to being able to work alongside you all. Thank you.
Thank you. We're really excited to have you on board. Just want to also note for the record that Amanda Bryant is with us as well.
It's really great to meet you. Thanks so much for joining us. So all of you should have received in your packet the minutes from last meeting. So I'll give you just a second to kind of review if you weren't able to review before today's meeting, and then we'll hopefully approve those.
As you review, just a couple of quick announcements. First of all, you will find that your packet is numbered with page numbers. That should hopefully be helpful. And then for those of us who might be new to the room, we do use the audio system to help us with our minute taking. So please do make sure to use your microphones. You can turn it on with the little person that looks like it has sound waves coming out of its mouth. That red light above will light up. That means you're active. And then just click it off when you're done. Go ahead and review those minutes and let us know if you see any corrections.
Does anyone have any comments or corrections? Does anyone need a minute longer? Would anyone like to make a motion to approve the minutes?
I'll make a motion to approve.
Thank you. Second?
A second.
Thank you. Any opposed? I get my words wrong. I've been practicing in the car all day. Say it. You say it.
First of all, any further discussion? All right. All those in favor? All those opposed? It was definitely part of it.
All right. I got so excited I wanted to say that word first. For people that are new, I am a hot mess. So there you go. I really struggle with that word opposed, so I might look at you occasionally. Okay, moving on. We're going to have a report on public and partner comment. Oh, no. Do we have any comments for public and partners? Anybody like to share anything to the group? No. Okay. Now we have a presentation, right?
Yep. I'll go ahead and give just a brief introduction. I had the pleasure of meeting Abby Latimer, a professor at the University of Kentucky, I guess now almost 2 years ago. She approached our office about trying to complete a hospital point in time count to kind of help capture those that might fall outside of HUD's regulations for a point in time count, but may still be facing issues of homelessness and or housing insecurity. So we are able to provide a little bit of guidance around how we conduct our local point in time count as they could develop something to run simultaneously. They did plan and execute that on the same evening as our 2025 point in time count. They're in the process of finishing up some reports that she and Dr. Lyndon Bond will be sharing with us, hopefully at the next Data and Systems Integration Committee. And then we'll probably bring it back here to a board meeting to share with our board members as well. Just continuing to help raise public awareness and kind of expand our view of homelessness. They had another project that Abby was working on with a colleague, Michael Light. They both are joining us here today to talk with us a little bit of a kind of brainstorming exercise around grief and supports for those who are frontline staff. We know this is something that obviously we encounter. I encountered it very early on in my career doing direct services. I know looking across me, I see Chris Primo, who's spoken about this at some of our meetings, and I'm sure that we are not alone in the room. So without further ado, I will turn it over to Abby and Michael to engage us in some discussion.
Thank you so much. So like Jeff said, I'm an assistant professor with the College of Social Work at UK, as well as the College of Medicine. I am a palliative and hospice social worker. I've been in the field for over 15 years. I'll let Michael introduce himself.
Yeah, nice to meet you. Thanks so much for having me. I'm actually all the way out from Seattle, Washington, so I'm glad to be back here in Kentucky. So Michael Light, I'm a social worker with the country's first homeless outreach palliative care service. It's a specialty service serving folks with serious illness diagnoses who are living unsheltered, and we use the HRSA definition of homelessness. So that includes folks who are living in permanent supportive housing, hotels, motels, doubled up. I'm also co-director of a palliative care training center at the University of Washington, teaching folks how to work with serious illness, mostly clinicians in healthcare settings. A lot of my passion, though, especially working in my clinical role for the last 9 years of this program, is really supporting all of our homeless services professionals, all the folks that really have connection and relationship who don't necessarily have the same training and support and resources and aren't also like capacitated, don't have a lot of resources to seek that additional kind of support and training, who are intersecting with grief and loss and serious illness on a regular basis, really trying to understand how to translate that deep relational knowledge that they have of folks that they care about deeply into their healthcare journey too, communicating with healthcare professionals and also attending to their own grief and their loss, which we see just all the time. It's really a part of our teamwork is realizing that this entire community of practitioners is really the service team is really kind of like who our team is meant to model and support. So
this project came out of last year, 2 years ago. I worked on a study to adapt a serious illness communication guide to help homelessness service providers communicate with individuals who have a serious illness and are experiencing homelessness. And from those interviews with homelessness service providers in the area and in Louisville, one of the themes that kept coming up was all of the death and all of the loss that they experience, and with limited resources and how to cope and deal, or even knowledge of how to attend to that loss. In addition to just attending to the potential anticipatory grief of many of their clients that they experience. So Michael and I got together and we decided that what maybe is needed is some type of infrastructure or support or training to attend to this. But instead of us coming out of it with our ideas, we wanted to start with you all first to get an idea of what you all have seen, what you all are hearing, so that we can co-develop this project, co-develop this training, or whatever it is that comes out of this with the communities in mind of what it is that they need, so to make sure that we have all the pieces and parts. So I think what we wanted to hear from you all, and pretty informally, and you can just speak up and we'll just be taking notes, so please feel free to ping pong off of each other. We kind of wanted just to hear from you all. Are you experiencing this? Are you seeing this? Are you witnessing this in your settings? And and what kinds of ways are you seeing this come up for you the most?
And I will just say that I know we have a shortage of the tabletop microphones. My staff will be happy to take a floating microphone around. If you don't have one available, just raise your hand and we'll be glad to get it to you. Microphone. Sorry.
Either one. Take your pick.
Hello, hello. Now I want to be boxed. Okay, sorry. So yeah, we experience this a lot at the New Life Day Center, where we have about 358 clients on our roll, and a lot of the ones that come regularly are unsheltered. So we end up finding out from other clients that they've passed away, and these clients are, of course, distraught because they've lived. Most of our clients have been homeless for 6, 7, 8 years, sometimes decades, and they've known these people their whole life, and they've become family with these people, and they share meals with them and struggles. And so when they pass away, there's a wave of grief, and not just a wave of grief, but like a picture of their own mortality, which I think is also a little scary, where they pass away of a drug overdose or something like that, where it's something that can happen to anybody that's at our shelter as well. And so there's a lot of grief and a lot of self-reflection that happens.
And just with that, it sounds like that grief is then coming to some of your care professionals
Yeah.
that are then trying to figure out, like, how do I hold that with them?
Right.
Maybe also their own experience. Like, they probably also maybe knew some of the people who they're finding out in that moment have died
Yeah.
as well.
Yeah.
So that's sort of like personal and the sort of like professional relationship, but like how to attend to both of those things.
Right, for sure. Like one client in particular, I had just spoken to him the day before, and he passed away that night. And then I found out the next day, and I was like, it just talked to him about the issue that caused his death, and it's and there, yeah, there's no way to prepare yourself for that. There's no way to I mean, other than compartmentalizing it so you can help other people. I happen to work at St. Jude's Children's Hospital in Memphis, so I learned pretty quickly how to put some boundaries up. But definitely, it's a need for sure, for sure. Yeah.
I think David, and then back there as well.
I'm probably loud enough without the microphone, but just so is the focus here on primarily on like care providers or on the homeless
Both and
population?
Yeah,
Okay.
yeah.
Because I see this a lot in people working in the field, obviously. And I think one of the things, like I've been around a long time, I'm dead inside a little bit. But it is very difficult. We went through a wave of like overdoses a few years ago. I think you and I talked about this before, but we had a wave of overdoses, and I think that was really hard on a lot of the staff, the clients as well. Not even necessarily because they knew the people personally, but just because of the volume that they were seeing and hearing about, and a lot of it's a pretty interesting community in that a lot of people know of other people, even if they don't know them personally. And so I think that word gets out, and there's just a lot of concern, and there's a lot of anxiety, and obviously a lot of grief. But, just thinking of the providers, I mean, you're dealing with everything from, we've had people who are on hospice care, and that's horrible just to think of, people in hospice care being at homeless shelters or living on the streets. But, dealing with overdose deaths and dealing with people who are, chronically ill who pass away. We have a guy with us now who's almost 80, and he's dealing with some pretty serious health issues, and like everybody in the place is concerned about him. So you run the gamut of like reasons that people are dealing with this loss, and I think that has a little bit to do with how the predictability. It's easier to cope with things that you see coming, but people who like you unexpectedly lose, or who have like overdoses or accidents, or you just weren't prepared for that can hit different. And I think especially for newer people that are in the field, they don't really have a frame of reference for that. I'm only joking when I say I'm a little bit dead inside, but I do have a way. I've been doing this for like 25 years, so I have a way of dealing with it. But I'm not sure that I would have dealt with it so well in the beginning of my career. And I think that, unfortunately, is a skill we have to learn because nobody's teaching you how to do that. And I think that's very hard to learn. And if you had a program designed at educating new people in the field, case managers, clinicians, that sort of thing, I do think it would be very, very useful, and would save a lot of. It's one of the primary reasons I think people burn out in this field is not being able to handle that. So,
I just appreciate just thinking about both of those reflections so far. This idea of what does it mean to be sort of like prepared or underprepared for something that is so common and so somewhat expected and so like integrated as like part of the role. And then if you stay in the work long enough, you sort of see like this is a natural part of, unfortunately, how people live and die in suffering in these circumstances.
Right.
It's part of what's expected when people don't have the resources for it. But
and I'm also not saying that those of us who've been around a long time do it in a healthy manner. I'm just saying we learned how to do it. Yes.
yeah. Affected differently.
Thank you. Yeah, in addition to, I think, as a culture, we don't do a great job of dealing with death and loss in general. But I think in particular with our field, I think as David was mentioning, that sort of potential for burnout. The thing that I see with colleagues and being in similar social work type fields, the people on the ground actually doing the work are stressed beyond their ability to cope in general because they're usually not making a livable wage. They don't have affordable housing themselves. And so when they are constantly just trying to survive themselves and also recognize sometimes that no matter how hard they work, it's not really going to help the person in front of them. And the loss of hope that comes with that. And that real loss and grief is part of it. And then on top of it, watching someone suffer in front of you, another human being suffer, we all tend to deaden that part of ourselves because it's just too overwhelming. So anyway, the connection between self-care and also, like I said, livable wages for social workers, affordable housing for social workers. It's hard to expect them to deal with death and dying when they're just barely getting by.
And what's your name? And
Derek Feldman, and I'm with the Lexington Housing Authority.
Okay, thank you.
Yeah, thank you.
It makes me think too, just from a comment earlier too from our friend up here, the number of people who are maybe working as service professionals who have their own lived experience of homelessness and like come up through like being in services themselves, and the triggers that sort of like come with that and like being exposed to this work sort of constantly.
I'll briefly share experience of my own, just because I think it touches on some of the other things, but it is slightly different. A lot of us also, when we are doing service work, are sometimes the substitute for the support networks that our clients don't have. My experience wasn't like Chris's, where it was an individual that was connected to a community of their peers. When I took my first social work job in a permanent supportive housing program, we did an assessment. We usually did those in the office, but in this case, we went to a home. A woman who was permanently banned from a local shelter was wandering the streets with her oxygen tank, 10% of her heart working, and she was giving her SSI check to some drug dealers to live in their home. And we gave her an apartment to live in. Of course, most of us know that that also doesn't necessarily mean furnishings. So we did what we could with grant funds to get her a bed. And I remember doing small things like, trying to find donated large print books that she could entertain herself with, bringing her a radio. And we very much were kind of her surrogate family. When she ended up in the hospital on a ventilator, we were the only people that came to visit her. We were the people that she listed as her emergency contacts. She introduced me to the hospital staff as her son. And in my early 20s, I probably didn't even know enough how to navigate that in general, let alone navigating all the nuances of that professional role and the dynamics of that relationship. So I think that's an important element, is that also sometimes it's a weight that you're carrying solely kind of on your own because there's nobody else that really knows this person, is available to them. And oftentimes I don't think the organizations that people work for, especially if they're not really solely focused on homelessness, understand some of what frontline staff deal with, the secondary trauma that they carry, and don't do a really good job of either providing resources for support or just making that widely available or known.
I just want to share with that. Like, I lost a patient 2 weeks ago who said to me just before she died, I don't understand, what is your role? I hear you're a social worker, but you're not like other social workers. You're more like my family. A person who went from such relationship dysregulation that she could not have a conversation with us our first visit to you are my family. You are the person that I'm gonna We spent her last months of her life, and then I was in the emergency room to prepare her body for her mom to come and see, that hadn't seen her in years. So it is really personal work. And I'm hearing your story. I'm like, yes, everyone in this room who's done some of this work, I always say, I get to live at the intersection of serious illness, palliative care, and homelessness. But if you're doing homelessness services work, you're doing palliative care work. And if you're doing palliative care work in the world, you're meeting folks who are unhoused. So everyone shares this work, and it has an impact. It's we're humans in this process. And that's even this conversation right now. How much time and space do we get in our work to have this conversation and appreciate the impact and the love that comes from that, the hurt and the loss that comes from a place of real love and care for human beings. Thank you for being brave and sharing that.
Yeah, I was going to say, within our supportive housing programs, it seems if we do with this, it's one or two. It's either a sudden death due to, a lot of times used due to a death related to substance use, or a terminal illness that's many times it's cancer. And kind of what obviously with the sudden death, it's that's a sudden impact. But then for the terminal kind of but similar to what Jeff was saying, the case manager, they don't have relationships, and most of the time the participants don't have strong relationships with families that are estranged from them, or they don't have that support system. So the case managers have to go through that, and just as a being the manager over programs and seeing the staff go through that, and the toll it takes on them, emotionally is tough to see. So I think that's a consideration as well.
Hello, I'm T.C. Johnson. I'm with Fayette County Public Schools. I am actually the former McKinney-Vento liaison for Fayette County. At the end of the school year, I was just kind of reflecting back because we had several young students that had actually lost their caregiver, their parent, and they ended up with a grandparent or a relative or even a great-grandparent, and ended up homeless. So it was like a triple sword on that. So we were able to always put in place support for those students. But it was a struggle trying to find that support that grandmother needed, because being homeless, and then now you're having to take care of young children. Where were the resources? So that became a struggle, and I noticed that we actually had several cases during out this past school year of young parents passing, and so that was a struggle with our students as well as with their caregivers. So, and then it left us like, you know, we were struggling like, how do we help this family? We're trying to help them, one, find housing and help them with other needs that they have and ensure that their child is going to school and those kinds of things, and then trying to also provide that grief support that they needed. So that was a big lack of a void that is needed there for those families.
Appreciate it. It makes me think about the relative work of like, you know, if you're like a case manager maybe in a shelter, you're working towards all these logistical sort of like resource support needs while also trying to figure out how to attend to this grief. And talking in the case of like children and families, you've got this entire family system that's impacted. And how do you attend to both of those things simultaneously?
One of the things that I keep hearing when you all are talking about it, and something we deal with a little bit, my name's Diana with Greenhouse 17, the domestic violence program, and we've often had to redefine what our term for success is. And I always worry that are we doing it, that we're kind of setting the bar lower than what we need to, but at the same time, what is success for a survivor that comes into Greenhouse 17 is that you will never get into another unhealthy relationship ever again. You know, when you're doing housing, is that you will, you know, you're going to be able to leave this program, you're going to be able to buy a house and have a job, and you're going to do those things. Where we kind of now are like, if we can get you into permanent housing, that's success. Like we're excited about that. And then we had a woman that we were working with who died of an overdose, and I had some newer staff, David, is sort of you were saying, and they were like, this is never going to happen again on my watch. But the response to that was nobody with substance use could come into shelter. Like that was their piece, you know. And so it was like me and Darlene, our director, had to come in and go, we can't not, I mean, you know, it lasted for an hour, but that was their piece. Like, we're not going to let this happen. And so, but to listen to your story and your story of like, maybe it's not that we can prevent the overdose, or maybe it's not that we're going to prevent the substance use, but we're going to walk through you with this. And the end result might be like, so when someone comes back to Greenhouse, again, we're really glad that they felt comfortable to call us back and say, I need you again, versus I have failed because I need you again. You know, it's a different shift on how you do the work. That showing up for people is really critical, and how we prepare newer staff to go, you've succeeded, even if they go back, even if they relapse again, even if they still are needing shelter and stuff. And I don't think our grants probably teach that, and I don't know if our schools teach that, and I don't think they think that's successful. So I think shifting that conversation could be really, really helpful, particularly for new staff that are not dead inside quite. I think we need to relook at that, because that's not human work. You know, people are going to die. People are messy because we're people, you know.
I think that's really valid, because I know in my own experience, I had to make an intentional effort to shift my perspective from she died alone here in this apartment without any support to we gave her a place to be comfortable and pass away respectfully. Yes.
You know, one of the things that, like, it occurs to me, like, when you're saying that, and you mentioned, like, you know, being essentially emergency contact or next of kin for these people, or feeling like they're your family. I think of the amount of times that people call me because I'm the emergency contact, like, or somebody, not just me, but any of us, because we're the only people that they have, and that's heavy. I mean, I'm sure many of us in here have made funeral arrangements, or you know, dealt with notifying you know, other family members that people have passed. And that stuff is pretty heavy, and you don't think about it when you're getting into, like, when you're getting out of school. You don't think this is going to be something that I do. You know, I mean, you think the opposite, because we're all taught, like, we have these boundaries and ethical guidelines. But, like, I feel like in the homeless world, it's entirely different. And because you are, like, essentially seeing people in their home every day, even if the home is, like, out on the streets. And so you develop a different type of relationship. And I think a lot of people really struggle with how to establish those boundaries and how to draw those lines, or even feeling that it's okay if I have this kind of weird relationship with this person that I wouldn't necessarily have. I'm guessing, before I came into the homeless world, and I was just like a counselor in an office somewhere, I'm probably not going to make funeral arrangements on a regular basis. So, that sort of that baggage that comes along with being in this field, I think, is very different than almost anything similar. So I think we also have to be willing to educate people on, healthy boundaries and how to handle that, but still making space for whatever the needs are of our clients. And also, as management, like I'm constantly pushing for EAPs and better services for staff. And I think all of us that have that ability are sort of have an obligation to do that, because it is a very taxing job. And, as Derek was saying, most of the people that work in this field aren't making a bunch of money and they come in with a lot of stressors, and many of the people that we hire are people who are also, formerly homeless or dealing with substance use or mental health issues. And so there's a lot to take into consideration whenever you're thinking about the potential issues that may arise and how to handle those. So I don't know, it's complicated. Now I'm depressed.
Well,
We bring the light here.
it's depressed. Sure, yeah, right. There's the heaviness to it. There's also so much meaning in it, and that's like part of what I hear like in some of this work. And listening to this group of people, I think about like this is a number of folks who are like seasoned in a career of doing this work and have been like figuring out this nebulous world of like, I didn't expect I was going to do this, and I'm suddenly thrust in this like grief, illness, loss world, and have found your own ways of like, here is actually what I can do with that. Here's what I say when someone comes to me with their grief. Here is how I actually like attend to death notification. Here's the like what the role looks like around these things that I didn't expect. And here's the wisdom. So there's the like, here's what I can functionally do. Here's the mental framework I have to sort of like put on that. These are like adjustments of what is success and this idea of boundaries. And I wonder, what are some of the things that you see your organizations or your teams doing that actually take this sort of like seasoned knowledge of here's what to do and here's how to think about it, that you're kind of currently doing to help transmit that knowledge, to create that support, to help people kind of come up in that work? Because I think that's what we're thinking. We're thinking of like, what's the thing that we can add to maybe what you're already doing?
What you're already doing, and then to what degree are other organizations stepping in, like hospice or bereavement counselors, anything?
I'm not sure, but I am someone who works with a lot of homeless, and they've had a lot of loss. And so I don't think they make the connection that they're grieving. So putting that together, and that's what I've been working on them with, like, just bringing to their awareness, like, you've had so many losses, and you are likely grieving, or you're angry, or you're in denial, or because it's a process. And I don't think that a lot of people talk about it or even recognize that you are going to grieve because you've lost. It doesn't necessarily have to be a death, but you've had loss. So just making that connection and helping them to understand that they are likely grieving has really seemed to be working for me.
And is that experience that you have on your own, or are you trained?
I mean, as someone who's had a lot of loss. It took me honestly, it took me a long time to make the connection myself. Like, hey, you are actually grieving. Yeah. Just fluctuating a lot between anger and acceptance. So it's, I think, just educating them on grief.
I'll see if this works. Yeah. From what I've seen, and I'm relatively new to my organization, but I'd say that work tends to be informal amongst colleagues. Someone taking someone else aside and just kind of listening or talking or sharing some wisdom or things like that. At least, and I could be unaware of some programs or something like that that's there. So that's a caveat, but I would say what I seem to see is a lot of just informal new people learning it on their own, and sometimes a colleague kind of, being a shoulder to cry on when needed, sort of thing.
Mentorship.
Yeah.
With our community action council, we have a contract with therapy service, so that as an agency, we will pay the copay so that staff can go see a professional and not have to worry about paying that because it's covered with the copay through the agency and with insurance. And then also as an agency, if there are situations that have arisen where there might be the need for that, and made therapists available for staff to be able to utilize in those times. And then also have done like sort of group team meetings with the therapists again, talk about different topics as well.
How many of those debriefings would you say that you've had to do?
I don't think, as an agency, I know we've done like 2 or 3 in the past year. They weren't related to any housing deaths, but we have like had individual cases where we made that service available for like individual staff when they had gone through something like that.
Was there a question down here?
Yeah. At the day center, we the last 4 or 5 clients that passed away, we would have a group with all of the clients, like a lunch, and give them space to talk about the client and tell funny stories and memories and give them a chance to honor that person. And I think that helps as well to not talk about it, but to actually talk about it. Yeah.
And the providers are involved in that as
Yeah,
well,
yeah,
primarily,
yeah.
or clients, or both?
Yeah,
Yeah.
both.
When our agency first started, we were a really small staff, and so there was a woman that was kind of starting out in her own kind of consulting thing, and she had worked for the state coalition, but she had done a lot of life coaching primarily on vicarious trauma. So we had hooked her up with all staff. There was probably about 15 of us at that time. So all direct service staff had to work with Tisha. And we did that for about 3 years. And really the conversation could go anywhere. So it could be life-work balance. It could be the struggles of the work, like anything that it needed to go. And she would only tell us if there was like trends. All of your staff are this. That would be the only thing she would share. So after a while, we kind of stopped doing that. But we were looking at kind of our census of staff. We had a kind of ridiculous amount of 10-year veterans that had stayed at Greenhouse 17. And so we were like, well, what's different? Like, how have we kept these folks? We didn't pay like tremendously well. It's really hard. Like, that wasn't it. So we were trying to figure it out. And I think we kind of landed that we provided this life coaching, vicarious trauma sort of work. It was just a really good foundation. So we tried to implement it. Well, we did implement it again, but in a much softer form. So we have a woman now who works with us, but in outreach. We call her a care coach. All new staff have to work with her 3 times. Any staff can work with her at any time. And then she also does sort of group activity works, which we call Tree of Trust because we're woohoo people. But because that used to be the thing, we would all go, everybody out to the maple tree. We have to talk. So it just sort of has morphed into that. But they can still work with Chris. And I think that foundation is really helpful. I like this conversation though, because it doesn't hit this topic head on. Like, I know you thought you were going to do this work, but you're really doing this work, and I think we've always worried a little bit about the over professionalization of our work. Like, don't get too close. Don't tell anybody you like them. That's wrong. Like, don't hug anybody. My goodness. So we've had to undo lots of things that people learn, in a college setting probably, or maybe where they worked before. But I will say, I think that coaching, that foundation, even like Marty probably was saying, giving people some therapeutic outlet to talk about the impact of this work, I think we saw that was extremely helpful to us.
You kind of brought something up as well that I wanted to dovetail that question to in terms of outcomes. So if you all had to identify outcomes that you'd like to see this training support, if we had to measure something or look at something, I know retention for staff is huge, also a little messy and trying to link it back to one specific thing. But if there were things that you would want to know how staff was doing or coping or whatever, do you have ideas on what you'd want to see it do for you or your clients or your staff, or what you think they would want?
Sorry. I'd love to understand or hear more from, frontline workers about what it is that they would like. I mean, we don't. I wonder. I mean, maybe you all are researchers or by trade, so I'd wonder. What do they need a couple of days off for grief? Like, is there something like that from them that they would say, actually, I'd just like a week off after this really intense thing that happened? Or I don't know. I guess it depends on the situation and what happened, but I'd be interested in what kind of ideas would come from them.
I think organizations probably almost need to have like their own therapists to help with therapists, because sometimes you just need to talk it out. I think that would be beneficial, but that's maybe just an idea.
Yeah, I can speak from the healthcare side too. Sorry, I'm right here. I can like move it here. So that made me think, Billy, of something we've just started at Eastern State Hospital. RISE, it's resilience in stressful events. I don't know if you've heard of that, but it's a peer led. So it is like staff, helping staff process stressful events. I was just thinking back, I think in a hospital, you're kind of insulated a little bit more. In a medical hospital, there's certainly a lot of death that you're dealing with. And, homeless individuals, obviously are part of that as well. But yeah, I know just in thinking back, our biggest thing in behavioral health hospital is death by suicide after discharge. And I was trying to think of any of our kind of frequent utilizer homeless patients that have died by suicide. I couldn't honestly really think of any. I know it's obviously happened, but a lot of the ones that we've seen, because if we do learn about a death that happens within a certain time frame, we have to do like reviews and that kind of thing, but it's usually not individuals that are homeless, interestingly, just from my experience. But yeah, the RISE is a kind of a peer-led support for when stressful events happen. And this whole conversation is just making me think about the Homelessness Day of Remembrance, and just how, like, I don't know if some of your all's work or could, I know we've tried to like make that kind of bigger each year, and I don't know how that would play into that.
And is that something that you put on in collaboration with any of the hospices or anything, or to what?
So we have the last 2 years done an event for National Homeless Persons Memorial Day, and one of our partners that participates in that each year is Bluegrass Care Navigators. They usually definitely bring some tools to the table and have some supports. We've struggled a little bit with getting a broader audience for that event. For our population of persons experiencing homelessness, oftentimes they don't have a desire to come in. Like the first year, we held the event outdoors so that it was visible to raise awareness. People who are living outdoors don't necessarily have a desire to come and hang out outdoors for an event. And then I think a lot of our professionals just see it as, here's another work obligation. And so that's something that's small scale, but we would like to see ways to make it better utilized. And I think for me, another thing, I would just like to see an increased awareness for frontline staff of resources that do exist that they can tap into, even if they don't all take that step. I think having that as an outcome would be a positive thing, because that the tool is there if someone chooses.
Thank you.
One of the other things, as I've been listening to this conversation and thinking, there've been a couple mentions about younger professionals, so people on very early on in their careers. I'm going to speak on my own perspective of someone who is very early on in their career. I guess for context, I am 24 years old, which is very, very young. And so one of the outcomes that I would like to see is among people that are very early on in their career, what are things that they are finding that make this very difficult? I obviously have my own experience. I've seen things that have made it difficult. And of course, things like mentorship, other resources within our organization, our partnerships, those things help. But really, for me, it's been being able to lean on my peers in age, peers in experience. But when you're in a field that's predominantly dominated by people who are seasoned, it's difficult to be able to try to find someone else in the room that's close to you in age to ask a question where the generational perspective would matter. So just comprehensive thoughts on younger people in the field.
This comment, like I spent 7 years working in a level 1 trauma center emergency department too. And like the people that I did overnight shifts with when those like deaths happen, especially the newer employees, right? Like those were my best supports. Those are the people that like, you know, you just come back from a trauma bay and you can like just break down crying. It makes me like just connect back to this comment of like, what does it mean to sort of just have the conversation and start the conversation, to sort of name that this is a part of the work, and to sort of like truly, I keep thinking like about like just ceremony and ritual, like there's a real spiritual side of this work, meaning, purpose, connection, that is really tied in with this grief work. And until you have the space to talk about it, and do you know what you need? Like just that sort of like awareness development, like how does that get you to a place like this is something we can talk about, this is something that helps me think about maybe what I need and like how we can support each other and like where I can go to. And like once you've had a conversation about like the really hard parts of your job, does that now feel like a person I can continue having that conversation with? Does it just open the space of communication around this grief work? There's so much wisdom in this room. I'm also thoughtful. I don't know how much time you've slated for us.
We're gotta be at it.
We probably do need to think
Yeah,
about wrapping
I
up
think
in the
it
next
came
few
to a
minutes,
nice-
but it's been very enjoyable, and I
Yes.
would definitely offer that we would be
Yes.
glad to have you back at additional
Yes.
meetings or to schedule something special for this purpose.
Yeah, I think that we would be in contact probably with next steps. It sounds like there's definitely participating folks here that would maybe, we could even like access the staff that you have and potentially interview, things like that to continue to co-create and develop this. So yeah, we would love to come back.
Yeah, just make sure you guys kind of have stuff that you would need from us. Is there anything kind of in closing, any final thoughts or anything that you would want us to go ahead and talk about as next steps?
I don't know about next steps. I will say, like, just from a personal perspective, like, thank you for sharing your wisdom and your hearts. I like being in this work myself, like to hear like this reflected and the thoughts that we have had around like what has been our sort of experience and trajectory in being in this work and what might other people want and need. This really helps kind of like, I think, create some buckets and ideas and like formalize a sense of how are people feeling. Like it's great reflection and it's great fodder food for us to continue like working on this. So really,
I'm also
thank you
happy
for
to put
sharing
anything
this.
out through our mailing list or our listserv, social media. If you want just us to put contact information out, if you have any kind of tool that you want to collect any of this online, we'd be more than happy to do
I
that.
think I foresee all of those things happening in the next steps. Thank you so much.
Thank you.
Thanks for.
I really like these conversations all the time, though. So just be a standing invitation. Yeah, thank you. Okay, thank you. So we're going to move to committee reports, and the first one is data and systems integration, and it's with Joy Andrade as the chair.
All right, thank you so much. My readout is fairly short, so I will go ahead and cover it. We met on August 6th at the Don Ball Center, and we kicked off the meeting with our introductions and proceeded to approve the July 9th meeting minutes with no changes or comments. We kicked off the meeting next with Adam providing updates on the 2025-2026 data quality plan. And it is important to note that at the time of the meeting, HUD had not provided the official 2025-2026 data quality standards. So they were working off information that they had gathered through webinars and such. Some of the biggest changes, and I think, are we talking about that today? I know we have to vote on it today.
Unfortunately, there's not an excessive amount more to report. I can say that we have gotten a little bit of additional guidance from our vendor around changes. However, there is not a publicly available copy of the data standards as of now.
Okay. All right. So some of the changes that we did talk about was adding a statement kind of within the standards that specifically would allow us to collect elements that were maybe not necessarily in line with HUD. So, like, for instance, additional elements, which included things like gender, which Adam did talk about, because that was one of the standards that they knew would change. So the addition of sex replaced gender. However, we are continuing to collect gender, correct? Yeah. And that change would go into effect October 1st, which I guess is still going to happen.
As far as we know.
As far as you know. And so we did a full vote to approve that data quality plan, and we will seek a vote today as well, right? Okay. And then I will go ahead and finish up though, so we can circle back around to that. And then Jeff provided an update on the local assessment tool, or is it LexHat officially? Okay, so the LexHat, and the new tool is live in HMIS. It is the default tool now, but the VSBDAT is still available for the time being as well. And then Jeff provided the coordinated entry report. Just some quick highlights is that there were 9 referrals during the quarter that were successful, and then as well as 16 successful housing move-ins, and that included the rapid rehousing and permanent supportive housing. And then lastly, Adam provided updates for the HMIS trainings, which some were in August, and then I believe he had some in September as well. Not sure if all of those have passed.
End user work group was yesterday, and new user training is tomorrow.
Okay.
At the Government Center.
Awesome. Okay, and then our next meeting will be October 1st at 1:30 at the Don Ball campus. And that is all the updates that I have. And then we need to vote on, I think it's a full board.
So the motion would come from committee, and so we would need a second from the board. Any further discussion on the data plan? This is included in your packet on page 9.
Page numbers. Very nice.
Hearing none, board vote. All those in favor?
Aye.
All those opposed? That motion passes.
Thank you so much. I miss Bruce seconding. I sort of paused as I looked at you, Liz. I was like, where's our second person? Okay, so we will conjure Bruce in that. Next committee is Program Performance and Evaluation Committee with Liz Sheehan.
Hello, everyone. We met on August 20th at the Don Ball campus as well, and we started with our approval of our minutes from our last meeting, and those were approved without dissent. And then we had 4 presentations. The first was from the Arbor Youth Street Outreach Program. They were well over their targeted people served. Their target was 75, and they measured 183. We talked about feedback that they had been receiving from clients about their services, and they said based on client feedback, they have been changing up some of the partnerships for people that they worked with to provide services. We talked about that there has been an increase in clients over the last 2 years, and that there have been more street outreach teams directing people to Arbor Youth from out in the community. We talked about mental health concerns and whether they had seen an increase in those. They said it was about the same, but having a therapist on site has really helped their clients open up around mental health. And we talked about one of their metrics was that they had distributed or served 6,071 meals and survival items. And the breakdown of that is that the majority of that number is meals, and some meals are donated, prepped meals, some are grocery items, but they said they really value community partners coming in to help with meal service and meal donations because it's helpful for the clients to see how much the community cares for them. So if you are a community partner or an organization that would like to partner with them for meals, seems like they would like that. The next presentation was from the Hope Center on the emergency shelter. Jump in here if you have any corrections. No. This presentation was done by David. They had served 1,600 people this year, which was an increase of about 300 over the prior year. A growing number of mental health needs, a growing need for clients that were aged under 25 and over 55. So kind of like the different age breakdowns they saw on the lower and the higher end, an increase. There are a number of people that are not accessing their case management services because they're just there for a very brief overnight or a weekend. We talked about their permanent housing data because there were 2% exits to permanent housing, but there was discussion over why that might be so low, and some of it is difficulty because people often leave and don't tell them where they're going, so then they can't count them in that number, or people go to another temporary location before going on to permanent housing. And then we talked about whether that 2% was similar from years past, and it was pretty consistent, 2% over time. And we talked about where that 2% get placed. So they work with some specific partners, and they have rental assistance programs that they use that go to like the first month's rent. Then, Jeff, you mentioned in that discussion that you wanted to confirm the percentage of returns and that you had noticed some discrepancies in reporting. So I didn't know if you wanted to talk about the APR report that you talked to the committee about.
We are currently still looking at that with our vendor. It seems like some of it's been resolved, but would want to take a little bit further look before we bring it back to the committee.
Okay. But people might want to be aware and check in with your office about that. And then we talked also about whether there is any specific case management to the under 25 group and the over 55 group, and whether we might be able to do some targeted kind of case management, particularly for the young group so that they don't become chronically homeless. And Jeff suggested that we could establish a COC work group around that to talk about a collaborative solution. So if there's interest in that, we could pursue that as like a subcommittee or maybe in the advocacy group or wherever that might fit. And then with the over 55 case management, there was discussion around the New Life Day Center and some folks that are in the higher age groups like 70s and 80s and are getting SSI but don't necessarily want to be placed in housing. And there was some discussion about how they experience some of that at the Hope Center as well. Then we talked, next presentation was the Hope Center Street Outreach Program. We talked about two types of contact, like basic outreach and then a small group of people doing more intensive case management in the community. Being very targeted about who gets on our coordinated entry program, and ensuring that the person that's put on coordinated entry are in a position to move in somewhere and that they want to move in somewhere. Then using the housing assistance funds to get people placed in permanent housing. And some of our discussion was around, let's see, there was a 25% of total persons served that have exited to a positive designation. So that was a significant outcome that we wanted to highlight. And that obtaining opioid abatement funding from the state to expand the Hope Mobile Outreach Program into the evenings, which could be beneficial for us. Then our last presentation was New Beginnings. This was the housing navigation for persons with serious mental illness, or SMI. They said that they've really had a lot of challenges over the year because of lack of vouchers for housing. They've also said that people stay with them to work on skills even after they've gotten housing, which is a positive kind of like, I think of it like aftercare, like they're still staying involved in the programming. They're trying to increase outreach to their targeted population. They are also trying to solicit participant feedback, but they said it's been very hard to do because they used to have a really long satisfaction survey. They've shortened that, but then don't have particularly good response rates. So the feedback that they're getting is mostly from one-on-one conversations. Let's see. What else was in our discussion here that we might want to highlight? We talked about referrals from Eastern State and how they're trying to, they want more referrals, so that has been discussion over actually multiple times, I believe. And then there was discussion of where they get mental health services from. So they talked about New Vista, Mountain Comp Care, Health First, and the Bluegrass Community Health Center. So those were all of our presentations. We had one announcement about talking about federal updates at the Advocacy Committee, and then we adjourned at 2:50. The next meeting, I don't have written down here. Hold on one second. Is
October 15th.
October 15th, right here on my calendar too. It is at the Don Ball Campus Center at 1:30. Thank you.
Thank you. Does anybody have any questions for Liz? All right, we will move on to advocacy issues and program committee report with David Shad.
All right, we do have a couple of voting issues here, so I'll bring those up at the end. And Liz mentioned the federal policy updates. We did talk about that at the advocacy meeting, which was on August 27th at the Don Ball Campus Center. So we talked about some of the feared changes were that some of the things like housing choice vouchers and CDBG funding were going to be cut, and those cuts were not, they did not happen. So I think we're saved from that for now. The original proposal would have eliminated the permanent supportive housing and capped rental assistance at 2 years maximum, which would obviously be a big issue for our chronic homeless population, particularly those who have disabilities and just need more long-term housing support. So I think for now that is not in the cards, but always something that we worry about in the future, or, you know, by the time this meeting's over, who knows? Strike that from the minutes. So Jeff also mentioned the potential for a COC competition that for this year, and it was previously expected that we would not have a competition for this year. So if that competition happened, the time would be compressed, and we would, I mean, the federal fiscal year starts in a few weeks. So, I mean, if you're looking at timeline, it's we are in a short time period already. So it would look a little different than in prior years, and be a quicker type thing. We also have some new programs that may be eligible: transitional housing, street outreach, that sort of thing may be eligible if there are new competitions, whereas they previously would not have had opportunity in those areas. We also talked about the work requirements, and I don't really know what we talked about with that, but we talked a little bit about the HMIS changes, which I think we already discussed in the prior presentation. And particularly some of the changes in terms of the gender field and that sort of thing. Jeff also mentioned the threat of the Housing First model being abandoned by HUD and federal government. You know, over the years, I don't know, the last, what would you say, 6 or 8 years, as long as I can remember, really.
I would say probably closer to 10. You all did your pilot in 2015.
Oh gosh, has it been that long? Wow. So yeah, during that time, the focus for HUD COC funding has been on programs that operated as Housing First, or worked with Housing First programs in some capacity. And, there is now the push to move away from that into a model that requires services, requires substance use, mental health care, that sort of thing, which kind of goes against what we have developed programs in our COC to be. So I think there is some ongoing fear about what that may look like, and you certainly see that language being promoted in everything that I've seen coming from the federal government. I think they're very clear that they are not fans of that model. And 10 years ago, I probably would have told you that I wasn't either, but now I think it's crazy to abandon something that has worked. Not that I'm going to get political or anything in here, Lord knows. So we did talk about that. We talked about, let me see here. Some of the restrictions on language regarding harm reduction. Yesterday, we had a notice from SAMHSA that we had to rewrite our grant because it referenced harm reduction. So we had to change to some very specific language. Essentially, like Narcan distribution is still allowed. There are some changes, but I think on our end it was mostly just wording. But we did talk about the potential for that, and it looks like it has happened since we last met. We also talked about the downtown safety and outreach expansion. As you all know, there were a couple of local incidents downtown involving unhoused individuals, and it created this conversation regarding public safety, and particularly downtown. We discussed some of the potential changes in regards to expanding outreach, to including more law enforcement presence downtown. Mentioned that Officer Norton had been assigned to work with that area, and paramedicine was also going to provide more support, and also our outreach team. We're making more of an effort to be present downtown, and I think that continues, and we've seen the change in downtown activity. I think that's certainly been pretty evident on our end, but I think it's part of an ongoing conversation that we'll have. Anything else on that?
No, I think that we can anticipate, David and I have been working on a projected budget to expand Hope Center's street outreach team, just so that can be an effort that we do have capacity to maintain ongoing. So we're in the process of working on that now, and hope to bring some details back to the board at the next meeting.
Yeah.
Hey, David.
Yes.
I was just going to let you know, or let the group know, for what it's worth, we're having the same experience in terms of grant agreements. We've had several rejected, we being the city, have had several rejected, where it's very clear that what they've done is just put it in ChatGPT.
Yes.
And said identify the word diversity. And then it comes back to us with just that word highlighted and instructions to remove that word.
Yes.
And so we're seeing that basically with certain buzzwords, which includes harm reduction.
Yes.
Is one of them.
And substance use harm reduction in particular has been a point of contention. So we had both of those things that were highlighted in our document.
Yeah, they particularly did not like the community paramedicine grant because it talked all about that kind of stuff.
Yeah. So
the interesting thing is, because they seem to only care about the word, you can literally just delete that, and you don't make any substantive changes to the work that's being done, and they're fine with it.
Yeah,
they just don't like the words.
I copied and pasted exactly the language that they said.
That's what we did.
And that passed. So, but they also told me to upload it to a system that wouldn't allow it to be uploaded, which sounds just like the federal government. It said that was closed, and you could only view the applications and not do anything with it.
The other thing they're doing, just for anyone who gets federal grants, make sure you're watching for this. All of ours are starting to get a clause in them that say they can be canceled for convenience.
Yes.
And basically that just means the federal government can yank that money whenever they feel like it.
Right.
And it did not have that clause before. Yeah.
I've noticed that. This is something to look forward to, I guess. So, yeah. And then Chris talked about youth homelessness, and we had a conversation on, as Liz mentioned in her presentation, on the growing number of 18 to 24 youth in our shelters. I talked about the Hope Center specifically. We had 133 people in that age range over the past year. We also talked about how Arbor's 18 to 24 bed capacity had reduced, and they were currently able to only serve 11. Chris talked about some of the changes in youth that made them different and made them more challenging to work with in many ways, including like brain development and just increase in risk-taking behaviors and emotional regulation, that sort of thing. And how being in adult shelters can create the potential exposure to more harmful influences and some just put them at risk for a lot of different things. And so we talked about the need for having a more specialized approach to dealing with this particular group. And again, talked about the formation of a work group to try to look at this issue a little further. So that was it for new business. In terms of old business, we previously had talked about income enhancing strategies, and we completed another activity looking at the feasibility and the priority that the people in advocacy group put on some of the issues that came up in the prior presentation. Things like transportation barriers, which would be an immediate intervention and also were fairly easy to do. And Jeff mentioned the one of our former programs, which was the one-year LexTran bus pass program, is an example of a way that we could easily create a solution to some of those transportation issues, and mentioned that he still had the equipment.
We actually had a meeting with LexTran last week, and we're kind of waiting for some additional information, but it looks like we should be able to resume some form of a program with them.
Fantastic. Yes. So in this, we looked at some of the other high feasibility interventions, and we talked about employer engagement, second chance employment, all of those as being critical, but also fairly easy to do. Things like resume building and application assistance to help with our participants get better jobs, mentorship programs that helped with skill development, crisis intervention, emotional support. We talked about barrier elimination strategies, again, focusing on transportation, documentation, and benefits. We talked about the potential for Uber and Lyft vouchers, things like eviction, record expungement programs, and the state ID program. So all of those were discussed as potential opportunities to deal with some of the issues that came up. And then Marissa did a presentation on the program standards and quality assurance with the emergency shelter standards updates that we will vote on, with enhanced eligibility, transparency, and personnel training requirements. That is a mouthful. With a focus on client-driven case management protocols through a service delivery framework. Let's see, client feedback was also a big part of the emergency shelter standards, as well as looking at eligibility requirements for program participants. And then with the street outreach standards, much the same thing. Personnel criteria that aligned with what had already been established through rapid rehousing and permanent supportive housing standards, and the case management and program enrollment requirements here in this area too. And also some additions to protocols on client file security and safety. Anything else on that, Marissa? All right. And then we had a brief discussion on the Medicaid 1915I waiver integration. Not a lot new on that, but that program is looking at providing some housing support services to people who are homeless. and providing basic case management, housing support, that sort of thing. And we mentioned some providers, which I think was me, scheduling meetings to kind of clarify what our roles would be and how we can participate, and that is still ongoing. So, and then our next meeting is going to be on October 22nd at the Don Ball Campus Center, 1:30.
And for the two voting items, the emergency shelter standards can be found on page 17 of the packet, and the street outreach standards can be found on page 27 of your packet.
And we already...
Motion
We
would
just
have
need a
come from
second,
committee,
right?
so we'll need a second from the board on each, and then an individual vote on each.
So on emergency shelter program standards, do we have a second for that? Okay, Chris seconds. Any discussion? Okay, all in favor? All opposed? All right, and for street outreach program standards, do we have a second for that? Okay, any discussion? All right, all those in favor? And opposed? All right, thank you.
All right, that's going to bring us to our encampment SOP and report. So one thing I can go ahead and update you on is that, as many of you know, the office received a new staff position for fiscal year 26. That is an encampment coordinator position that is intended to allow this office to have someone who primarily would work in the field in conjunction with partners like our street outreach teams, as well as folks like environmental services, code enforcement, and parks that would actually work on removals of camps. And I am excited to be able to say that much quicker than usually happens with positions in a fiscal year at the LFUCG, I not only have that position posted, created, but it will be filled as of September 22nd. Steve Gehafer, a code enforcement officer who presently already helps with our homeless encampment removals, is moving over to our team to work with us full time. He comes to us with a background in law enforcement and a lengthy history with code enforcement. He's probably been working on homeless encampments for about 8 to 10 years at this point. So we're really excited about the possibilities of having him as a dedicated staff with us. So we'll be definitely revising the SOPs in the near future to reflect inclusion of that position and look at how we realign some of the responsibilities within our process to best facilitate positive outcomes. For the meantime, I'll go ahead and give you the report for this meeting. This would cover anything from July 1 forward. So this is going to reflect fiscal year 26. All the summary totals at the end of the report will have started over from the previous fiscal year. We had a total of 5 locations that were included in this report. The first of which is on West New Circle. This is a property that has been acquired by our water quality department, but they have not yet occupied the building. We're finding that there's been some repeat issues around the building. We worked on this with a notification from code enforcement on July 8th. Numerous contacts made by street outreach with the same individual residents. Unfortunately, services were declined on multiple occasions. First notice was posted on July 8th with a final notice posted on July 18th. Cleaned and removed on July 21st at a cost of $550. We recently started including the cost of dump tickets to get a more full and accurate picture of cost. However, for this particular cleanup, those costs were not yet available to me. Location number 2 was a camp on Nandino Boulevard. This was notified to my office by police on July 2nd. We had 2 residents that were consistently the same individuals there. A little bit of contemplating of change, but right now they were not ready to go ahead and engage in a service plan towards permanent housing. We were able to provide some services like connecting them with paramedicine for some health needs. And then around the time of removal, we did transport one of those individuals to the Empath Center. First notice was posted on July 8th with the final notice on July 18th. cleaned and removed on July 22nd at a cost of $2,672.57. Location number 3 is a little bit unique. It was on Gray Lag Way behind Lowe's. It involves a portion of state property, of LFUCG property, and a portion of private property. We cleared the majority of the encampment itself. We got some assistance from the Transportation Cabinet on addressing landscaping needs along the I-75 exit there to help reduce the likelihood of future encampments in the same area. This was notified to us by Councilmember Gray's office on July 2nd. We had contact with one individual on that date who accepted basic needs supplies and expressed interest in services, did schedule some follow-up contact with outreach, left that location. We did have some additional residents move in at a later time, closer to the middle of July. The original posting of that was on July 8th. A final notice was posted on the 14th of July. Then, because we had some delays in scheduling the work, we reposted on July 22nd. And that removal occurred on July 24th at a cost of $3,814.27. Location number 4 was at Buena Vista. This was an abandoned camp that was notified to us by code enforcement on 7/28. We had outreach out of an abundance of caution, make a couple of attempts to confirm inactivity. As there was no activity identified after multiple visits, we did not need to include a posting. That was cleaned and removed on August 4th at a cost of $804.93. The 5th and final location was at Pasadena Drive. This was notified to us by police on July 21st. We had contact with 2 individuals. Unfortunately, these individuals are repeat residents of other camps that we've worked in the past and are still at this time not willing to engage us in a service plan. They did express upon notification intent to relocate. We made multiple attempts to ensure that either we were working towards a plan or that relocation was achieved. They had a posting at this location at July 25th, a final notice on the 12th of August, and then cleaned and removed on August 18th at a cost of $1,250. So in summary, this is going to reset our totals, and it's going to bring, out of the 5 camps that we worked, our average cleanup cost to about $1,818. A median cost is very similar at $1,250. We had 1 camp with no contact and no active encampment. 4 locations where contacts were made. Unfortunately, we did not have anyone successfully engage in a relocation plan with us. So that is the report for this time around. Open to any questions. All right, hearing none, I'll just continue on to my next agenda item, which is going to be the director's report. We'll start with a budget update. That will then inform the next item, which is regarding winter response. So we are now completely closed out on ARPA funding and are working with only innovative and sustainable solutions dollars. I did include fiscal year 24 in this packet. You've seen this information previously. Nothing much has changed. We did have a small amount of remainder funds from the feasibility study for our shelter study. And then we also had some funds left over from our original agreement with New Life Day Center. So for this fiscal year, we had approximately $744,000 that has not been spent. And that was largely in part because we had received about halfway or a little past halfway in the year. We had our funding doubled for that year. So just a little bit of time needed for us to kind of catch up to spending at the increased level. For fiscal year 25, you will see the Innovative and Sustainable Solutions Fund, which is board controlled, as well as general fund dollars supporting winter response. For things like winter response, where we have general fund dollars that remain unspent, typically that would go back to the general fund and not return to the Innovative and Sustainable Solutions Fund. Regarding our fiscal year 25 funds, we were able to close out our winter program with Community Action Council through final invoicing. We did a really good job on projecting those needs. We had just over $500 remaining on that amount. We also had several items that went under contract in fiscal year 25 that we are just now starting to receive some invoices on. So this will look a lot different next time I've processed some of those, even since this packet was sent out. Other programs, we have Hope Center coming to the end of year 2 of their street outreach agreement, which means we have one additional annual term before we would look at bidding out that project again. We are in year 2 of the intensive case management program with Independence Place, now part of the Center for Accessible Living. And we continue to hold space for the landlord partnership program with Lexington Housing Authority to be renewed for additional terms. As they had significant funds remaining on their first year, we have extended their period of performance on that through the end of fiscal year 26, and then we can reevaluate. That leaves us with about $147,000 that remains unallocated from fiscal year 25. Moving into fiscal year 26, you're not going to see a lot of expenses yet since we're so early into this year. We do have our COC planning grant match set up for the next COC planning grant that we go under beginning January 1. We have already paid out our HMIS subsidy, and then we have budgeted funds for continuation of existing programs. The Flex Fund, you'll definitely probably hear about sooner rather than later. We've had some pretty significant use of that resource. A lot of partners are excited. Chris is chuckling because Chris has made heavy use of the Flex Fund to move clients into permanent housing, which is exactly what it's intended for. Still working on figuring out exactly where we are at with initial invoices. In about 2 months, Community Action Council has expended about $81,000 of the $200,000 that was budgeted for them. And I know Arbor and their initial invoice submitted for around $14,000 out of their $100,000. So definitely we may come to a point in the near future where we may potentially have to either commit additional funds or pause the program. So hoping to bring some outcomes data once we have a couple of months under our belt back to the board so that you guys can consider what we want to do moving forward. That leaves us with about $385,000 for fiscal year 26 that is not yet allocated. Once we move away from things like ARPA funding, where it's grant accounting versus general accounting, it's a lot harder to understand the amount of money that we have available. So just to make it a little simpler for you all, we have just over 1.3 million in unallocated funds right now that are at our disposal through the end of the fiscal year. Obviously, this is a closed fund, so those funds would remain with us at the end of the fiscal year. However, we still do want to make movement towards expenditure because if we consistently underspend, the message to the administration would be that we don't need the funding. That's going to bring us into our next item, winter response. I think everybody, yeah, absolutely.
Here's the microphone.
And I
You
should
said
have
they've
paused for questions, I'm
already,
sorry.
for the community action, that they've already expended 81,000, and that was in a couple months. Do you think they will run out before we get to our next meeting?
There is some potential. It's variable depending on things like the capacity of staff to process applications, the number that are received, the amounts that are received. Marty may be able to speak to this. I would say we'll be close-ish.
Yeah, I would say so. I think I did a tally before I left. I think we were at 94,000 for approved applications, and that's over. I think we had 64 that we approved, and we have some, I guess, 15 pending, plus a few others that have come in the last day or two that we haven't had a chance to review.
So I don't know if the board would like to consider any kind of action on that now. My only hesitation is that we don't have a lot of outcomes data to really speak to the effectiveness of the program. And I think we've learned through things like housing stabilization that even if we had millions of dollars, that it could be exhausted and exhausted fairly quickly. So it's really about the priorities of the board and how we would want to use the funding that's available to us.
Okay, if you feel like it would be good to wait to get the outcomes data, I'm willing to wait to have the conversation, but I just want to make sure that they have enough for at least to get us to the next meeting. So
Yeah, I think probably with processing of things, we could get to the next meeting, but I think we just wouldn't be able to continue much further beyond that. I can also look at potentially if one of the agencies, like if Arbor's seeing a lower expenditure, we could always look at potentially shifting some of that money to community action if they're seeing a higher volume of applications.
thank you.
Thank you. I think that was part of my question is that, do you think, I noticed the reason why Arbor's not spending as much money, I think is because they're only getting families. And there's not as many families. I mean, for a while it seemed like there was a lot, but then all of a sudden everybody gets a single person. Do you think they could take on doing people that weren't families, or is that not?
I think it's something that we could talk with them about. I don't think that they're present in the room today, so I wouldn't want to make any decisions on their behalf without consultation. We initially kept it to where they were processing applications that dealt with either families with minor children or with youth 18 to 24, so it seemed more aligned with their mission. My thought is, I know that they are in the process of doing things like hiring an assistant director right now. There's been some movement with staffing, and so I would think that we probably would not want to at this time immediately do anything to put additional burdens on them until they have some additional layers of support internally.
Yeah, that makes sense. I know that when one of their staff was on vacation, I was sending even families to Community Action Council. Is that okay?
Community Action Council can take applications for any applicants
Okay.
to the fund that meet any of the criteria. I think one thing that we just want to make sure of is making plans for if there's a staff member that's unavailable, that there would be some kind of internal plan for the partner to continue operating the program without ceasing operation. Other questions related to the budget? All right, then I'll give you a little bit of information about our winter response. All this is still in development, as everybody in the room kind of hopefully knows by now from our shelter study and conversations that we've had. Our year-round shelter bed capacity is insufficient. Essentially, if we look at what our point-in-time count shows us, if we were to remove seasonal resources, our system, if it saw the same levels of persons accessing shelter as we did on that evening, would be operating at something like 123% of our capacity. And if we remove overflow beds, things like cots and mats that are not intended to be used on a nightly basis, we're operating at closer to 160% of our capacity. So there is a need for us to scale up resources during the winter season when there's more inclement weather. We see persons who would other times of the year not ordinarily access shelter doing so when the weather necessitates it. This year, we are looking to return to a site-based model, operating a temporary shelter similar to what the Hope Center did in winter of 23-24. And so part of that movement was we saw challenges with the hotel-based model of really being able to maintain the resource with the spirit with which it was intended, which is an emergency tool to keep people safe during inclement weather. And with the hotel program, we have finite rooms and we cannot just continue to place additional persons if we don't have any rooms available to us. That created access issues where some people might have remained on a wait list for significant periods of time until openings became available. It made it more challenging if somebody was, say, discharged from a hospital and without a place to stay to quickly get them in. I did my best to remain in contact with folks like law enforcement and paramedicine and facilitate those after hours. But it was definitely a challenge at times throughout the season. A comparison would be in the 23-24 winter with the Hope Village, we served 1,004 unique persons versus serving only 322 unique persons with the hotel-based model operated last year. We also did not see a huge difference in terms of the outcomes. Permanent housing exits were somewhat similar. There was a longer length of stay, but it didn't necessarily, that length of stay did not significantly correlate with more positive outcomes. So we are looking at use of a LFUCG property that's located at 1306 Versailles Road. We have put 2 agreements before the council with Emergency Disaster Services. That was the vendor that the Hope Center utilized for the rental and installation of their structures. That's one of the agreements that we put before the council. But then we would also have put an agreement in front of the council for operations. EDS has performed this kind of work for natural disasters. They've also assisted in communities where there was desires to relocate homeless encampments for things like sporting events that might come to town. So they do have extensive experience in this area. That went to work session yesterday. We'll go to council on Thursday evening. We're actively engaged in meeting and discussing concerns with our neighbors at the present time. The reason that we pursued having EDS operate was because we lack anyone within our system right now that could actually fill that gap. What we're talking about is essentially for 5 months of the year that someone be capable of setting up, operating, and breaking down an emergency shelter serving 200 or more persons. This year, we are looking at a capacity of 216 men and women. And that is something that we've had Community Action and Hope Center be involved in these winter responses in the past. It's very difficult to scale up staffing through temporary hires. You would pretty much need to get started months in advance to have that staffing in place. You would have to be concerned about if that staff had the right tools to adequately operate. And then last year, we tried an approach where my office was more of the direct operator of the hotel program with supportive service agencies that assisted. That also had significant strain on my office, but also the partners who delivered supportive services, spending a lot more time with the winter shelter than they had kind of budgeted or planned for. Knowing that we are seeing increased levels of our work, that we're trying to do things like expand our outreach presence and really improve our strategies to move people to housing, we cannot continue to put that burden on a single individual agency that does not have the capacity. So that is why we are looking at turning operations over to this group. They would be offering a turnkey operation that will involve intake and administrative staff that will provide general management of the shelter, janitorial services, medical services. 3 meals per day will be provided, a hot breakfast, cold lunch, hot dinner, and standard beverage service. And we feel really strongly that moving back to a emergently available drop-in shelter is a strong approach for us. However, there is going to be a slightly higher cost overall across the 3 components that we generally operate. Our main solution, which will be the site-based shelter, some additional funding for families going to Community Action Council, and an RFP that's currently out for our elderly disabled program that in the past has been operated by Bluegrass Care Navigators. We're going to be overall looking at an increase of about $400,000 or so from the previous year. We had a commitment in the general fund this year of $2 million for winter response, which is I'll be honest, it's high for something that is seasonal. We don't want to continue that. That's why we've presented a study to council with recommendations for additional low barrier permanent shelter. However, until that occurs, we need some kind of a gap solution, and we feel like this is the best solution that we can offer for this year. So what we're looking for is for the board to consider an additional commitment of $500,000 that would help us to operate those three different components. And again, knowing that that cost is high, but that this is something that is going to be a temporary need, we will continue to see until we would get to permanent shelter. Now the task force should be getting together and should start to meet, I would hope, probably in about another month or so. But we know that, they're going to need some time to make their recommendations, and then we would have some time with things like acquisition and development of property. The other thing that we wanted to go ahead and put on your radar is we have operated financial assistance for winter shelter participants the past 2 years, so that ideally they are not displaced when those temporary programs come to an end. Oftentimes our temporary resources end up serving folks who might have barriers to other forms of shelter. They might be of a population that is not served by another program. They might have pets. They might have significant mobility issues that prevent them from going to congregate shelter, or they may be restricted from other shelters. So we have used that money to do deposits and initial rent for individuals that have income that can work with the case manager and develop a sustainable housing plan to end the season with permanent housing rather than exiting to another shelter or to the streets. This year, we are seeking to get that approval from the board on the front end of the season. Generally, we would do this after the first of the year and operate for the last couple of months. We would ask for the upfront commitment for 2 reasons. One would just be to increase the availability of the funding and make those exits possible all throughout the season, potentially decreasing the number of people who are there each night or need that resource. And then the other reason would be just to try to increase engagement in housing-focused services. We do see oftentimes towards the end of the program a higher level of engagement. Sometimes that's because of the availability of the financial assistance. Sometimes it's because of the pending closure of the temporary resource. But we would like to see that again. In the past, we've done about 40,000, and that's been sufficient to meet the need, usually with a little bit of money left over. So that is going to be an outline of our winter response plan. Definitely glad to take questions from the board, and then we can move to potentially vote on some funds. Any questions?
Thank you so much. Just a clarifying question. Just in general, curious about having this vendor. You said the name of it, EDS, or did I miss that? EDS. Okay. Could you just talk a little bit about accountability for them? Just in general, I'm just thinking in terms of an agency that was local, or they're members of the community, everything like that. An outside vendor. Can you just talk a little bit about how are they kept accountable in terms of what they've done, or how staff is treating or the clients, or anything like that? I just wondering if you could talk for a second.
So even though the company operates nationally, they are locally
good.
situated.
Oh, good.
And we have gone through a rigorous process of contract review with both legal teams, and have finally resolved that. But essentially, our legal team has reviewed extensively the contracts and requested revisions that would allow us to pursue remedies if there are issues with that. Moving forward, we're also going to be having front-end conversations with EDS to plan for our expectations, our needs out of operation. For example, how we collect the information that we would need for things like our homeless management information system.
Thank you so much.
Any other questions from the board on our winter response?
So one question, and really more contextual question.
Mhm.
So I see on here that EDS provided the structures for
Mhm.
the Hope Village in 23-24. Um, about the Hope Village in 23-24, could you sort of speak on the experience and some challenges that were present when that sort of shelter model, if you will, was used?
David might also be able to speak to some of the challenges. We saw that it was a safety net for our community in a way that was broader than just literal homelessness. A lot of persons that were experiencing more transitional homelessness, maybe newly evicted from housing, were accessing that resource. We even had some situations where individuals that maybe had homes where there were code enforcement violations or condemnations might have accessed that. So one, we just feel like it's a broader level of support for the community. We had a really high ability to engage people in supportive services because of having a site-based location. One of the things that we saw with the hotel-based model was that while we did have funded partners to provide supportive services, it's much more challenging to reach somebody when they are behind a private door, and may not potentially at the onset of the season be motivated to engage regularly with the case manager on a plan because and maybe in their mind they're just kind of enjoying that reprieve from their typical situation. And so we had a lot of abilities to do things like hold weekly events where different supportive service partners could come in and we could navigate people to the resources that were relevant to their situation and their needs. And so we think that we would definitely have an increased ability to deliver social support services. The challenges I think that we primarily had were going to be a lot of the typical challenges that you would have with operating any kind of emergency shelter, with particularly maybe just a slightly higher acuity of needs, since oftentimes we are talking about persons who maybe do not have the ability to return to another form of shelter. Beyond that, I think probably the primary challenge was mostly in neighborhood engagement on the front end. We had with the Hope Village a neighbor who was very unhappy to have us, even though we were in an area that was across from an existing homeless shelter that we felt like was not very heavily residential, and it still had significant opposition. No surprise, we again this year have some folks who are not happy with the location. There is no ideal location for this kind of operation. And what we would argue is we as the city have a much better ability to engage neighbors in long-term planning towards shelter if it is permanent in nature. If I and my office are starting the process of developing seasonal shelter pretty quickly after operating shelter for half the year, it just doesn't leave a lot of opportunities for us to devote time to that kind of engagement and planning. So hopefully that helps a little bit and giving some additional context.
Thank you.
As far as beds go, how are they divided up? Or are these all the? I was looking at the picture of the beds and stuff. Is every dorm all gender?
So we haven't yet like officially divided out the structures, but what I envision is that we're going to have roughly, they're probably going to have to separate on the basis of gender largely. What we are going to be able to do is also look at what our capacity and utilization is at any given time. There might be some opportunities that we can better serve some individuals by shifting things around. But right now we're looking at 4 different structures that would have a total of 216 beds. Yeah. TC? Yeah, we're gonna, like we did last year, we're gonna give some additional funding to Community Action Council for hotel stays for families, knowing that this environment would not be appropriate for them. We have not yet determined that amount. The email I circulated to the board used a placeholder value, which was the funding that we committed last year. Community Action is working on getting me a budget that I can get before the council. But right now, I'm expecting we may have even maybe potentially a slightly reduced amount that's needed, just because they do have some other funding that have been previously awarded to assist some of the families on their wait list. So that should kind of help overall reduce the need in that area. But we know that we'll have to make at least an initial commitment. And like we did last year, if it's not sufficient, we can always come back to the board for additional.
Thank you.
As far as the $40,000 you said to help like rehouse, is that what that's for? Like, I'm not rehouse, but like to house those individuals afterwards. Are we like, is that for like first one's rent and deposit? You said.
Yes.
How many? Because you said there's 200 beds, so we're not. I mean, of course, we're not going to be able to house all of them or help all of them, but that's not very many. Is there any way we could add funding to that?
We could. I think my concern about on the front end now committing a higher number, you could. We don't have to necessarily, you could make a higher commitment and we don't necessarily use it and then it returns to the fund. I think what my concern would be is I'm asking you for an additional commitment of $500,000 just to operate all of our different shelter options over the season. And then we're taking a small amount more to do financial assistance. We also have the Flex Fund that's also available to help with financial assistance. We're talking about potentially in the near future putting more money into the Flex Fund. We're talking about expanding outreach. What my concern would be is getting us into a position at this stage in the fiscal year that we may not have funds available if there's an emergency need that arose.
That makes sense.
And I'll add to that we have some funds that are available to our outreach team, and they're engaging a large number of this group too. So I think the last time we were able to work those two funds to kind of meet everybody's need, I think we probably have an equivalent amount left. I think we probably have 45,000 left in that. So, and the bulk of that in years past has been spent on winter shelter, housing from winter shelter, and I suspect it will be again. So,
yeah.
So we can, when you think of those two funds combined, I think that does bulk it up a little bit.
What I would say is two items on this. One would be we will have board meetings between now and the end of winter shelter operating. Ideally, like around January, that would be a perfect opportunity, or even going into the March meeting if we needed to pursue additional funds. And I would also just say that those funds were available to winter shelter participants of a similar level. We served up to a peak of 225 at one time on a single night at the Hope Village. And then our capacity at the hotel program was around 190. And so it's similar numbers. And part of this is just some of the individuals that are going to be accessing that resource do not have any kind of income that's going to be able to sustain them in housing, or don't have income that's at a level that they are going to continue to be able to afford that rent. So even though I know we have a desire to house as many people as possible, I also think that if we overfund it, that might lead to people trying to force someone into an unsustainable housing situation, which may actually make their situation worse.
And I'll add one thing in terms of the structures, because Chris mentioned like the separating, and I know this from our experience in talking with EDS about this, and our concern didn't really materialize, but they do have the ability to like add walls to further separate and to make additional space. Like if you have had more males and females, then you could allocate the space inside. So there is a little bit of flexibility in terms of that, which I think becomes pretty useful in a area that large.
I think that was my concern, is that working at Arbor, when having the shelter and having the only 5 rooms with so many number of beds, not knowing how many of what gender we would get what night. We would have to change rooms around and move beds around to accommodate.
Yeah. And one thing I could say is like this design with the 216 beds, they have told us that that actually leaves a decent amount of space within each structure that they could add even additional beds. So what I'm thinking is if we have extra space like that, instead of adding additional beds, it might help us to create kind of more of a modular space that can be kind of designed to our need.
What about their stuff?
So we're gonna be doing pretty much what we were with the Hope Village.
I didn't know what y'all did with Hope Village.
So they're gonna have to largely keep their belongings to what they would need on a daily basis. We are just unfortunately not able to offer storage at a high level.
Okay.
I think we did allow them last time and would again to park their carts. There'll be like a parking area where we wouldn't take those away or prevent those from coming.
Maybe even have like bicycle racks and things like that, because some of them have bicycles, and I know at the day center we have bicycle racks for them to park their bikes and stuff.
We're open to suggestions. I just can't guarantee at this stage what's feasible and what's not. Everything is going to be an exploration. At this point, I don't actually have a contract.
One thing I think though is really positive. So if this is approved, this location, and if it's a city location, we're ahead of the game next year of having to identify a whole nother space. And then I will hopefully, and also maybe some of the structure that was kind of laid down for this winter season can carry forward. So would it be maybe a little bit cheaper next year to restart this whole process?
This is largely between us, because I don't know that there's some people that would love to hear. That would be a possibility. I think obviously we as a city would need to look at the impact to the neighborhood, how we are able to mitigate issues, how we are able to navigate those relationships. But ideally, there would be the potential for these utility hookups to remain in place and be used in the future if there were a need and the political will to do so. Any other questions? All right. Hearing none, I know that I would like to go ahead and just ask for a motion, if there's someone who feels compelled to do so, for a commitment of $500,000 from the Innovative and Sustainable Solutions Fund towards our winter response.
I move.
All right. That's a motion from Chris and a second from TC. Is there anybody that would like to ask additional questions or have further discussion before the board would vote?
I just want to verify, is this coming from a particular fiscal year? Would it be the 2024 balance or divided among them?
Right now, anything outside of what shows in our current fiscal year is sitting in fiscal year 25. Each year I move our balance forward after a year-end closeout. The problem right now is that they're still doing the year-end closeout, and I can't fully move all those funds forward until that process is complete.
Okay, thank you.
It's first in, first out though, so the oldest money would get spent first.
Hearing no other questions, board members, all those in favor?
Aye.
Those opposed? All right, that motion passes. And then I am open to whatever level of funding that you would like to consider for financial assistance for that purpose. We would need a motion since I'm not specifying to you what level. We think 40 is sufficient, we can do that. If we would like to make a higher number, we can also do that. Is there a motion?
I just have a question. Do we know how many people we helped last year achieve housing?
I do. I don't have it in front of me, so I don't have it in my brain. But I know that we did not exceed 40,000.
Okay.
We got somewhat close to it, and then we also had one or two payments that were returned to us when someone didn't actually move into housing. But there was a little bit of padding. And if you guys want to have some open discussion about that, you can.
I was just gonna say I would move to allocate 40. knowing that we have meetings during the winter shelter time where if we wanted to allocate more, we could. So moved.
All right. And where was that second? Thank you. All right. Any additional questions around that? All right. All those in favor?
Aye.
All opposed? That motion passes. I will give you just a very brief update here, then I will stop talking. So did want to kind of update you. David alluded at advocacy. We had talked about federal policy updates. Obviously, recent executive order that threatens funding to communities that actively practice housing first and harm reduction policies. Desire to try to get persons pathways to involuntary commitments at a little bit more flexible level. Some of those things could potentially be helpful to meeting some people's needs. I think a lot of it's about the execution of how that's approached. And then, as David alluded to, some of the concerns that we had around budgeting for homeless assistance programs did not come to pass. Positive news would be that it looks like CDBG funding and continuum of care program funding were not going to be altered significantly, but they did not fund the home program, which does provide a lot of leverage funds for things like the Office of Affordable Housing. So there's definitely some impacts to the community there. We had also, as David mentioned, been told that we should expect a fiscal year 25 continuum of care program competition. In 24, we applied under a 2-year NOFO with the expectation there would not be a competition this year. We got an email now, I guess about 2 to 3 months ago, that announced that this would be coming. We completed a grant inventory worksheet, which is usually the first step in that process. However, there's been no further communication. To give you a sense of what our general timeline is, we typically see a NOFO released in the summer around July. We would then go into our competition and operate our local competition for organizations to apply for funding. And then we would have about a month to go ahead and wrap up our actual community application that frames that. The latest competition that I've actually worked in this office and seen was fiscal year 21. We had a NOFO that was not released until mid-August, and that resulted in us having an ultimate deadline of November 12th. So if we think about this timeline, it's starting to get very suspect that we will see a competition because we are approaching the middle of September. And if we did not reduce any of those time frames, we would be running like very close to the end of the calendar year. And I don't suspect that we would see that extend beyond the calendar year. So at this point, my thought is potentially that some of the policy changes that the current administration seeks to implement have potentially taken longer for them to actually implement and to then update things like the guidance around this program. I'm not sure that we're actually going to see that competition. I think we may see just an automatic renewal of flat funding to our currently funded programs. But if we do see a competition, my expectation is that it's going to be one with a very quick turnaround. So I apologize to any of our COC recipients or potential applicants because that would not be ideal, but we'll keep you updated. Any questions around our federal policy update? All right. I am looking and seeing that I did not include an actual day, but it is November 12th. Thank you, Diane. That will be the next meeting here at 1:30. And now we are at other issues and public sharing for issues not on the agenda.
Jeff, I just wanted to share, I know I shared at the earlier meeting, but I am leaving Eastern State and UK Healthcare to go to University of Kentucky College of Social Work, so not going too far as a faculty member. So hope to remain on the board if you guys will have me. But I just did want to let everybody know about that I would be transitioning out of that role September 30th, end of this month. So.
Is there anyone taking your place in your
Sharon Harris will be in the interim for sure. Yeah.
I want to say congratulations again.
Thank you.
Definitely going to miss you at Eastern State, but I'm excited for you to join the College of Social Work and that you got to meet one of your new peers.
I know, that was very convenient. How ironic that happened. So that was nice.
Other announcements or public sharing?
On Saturday from 11 to 2, there is going to be the Art of Healing. It's a domestic violence prevention. It's going to be at the Central Library. In my new role, I am in charge of a lot of our community events. So for Fayette County Public Schools, so we will be represented. We'll have a team that'll be there to represent. Pass out books.
Thank you. If you ever feel like there's events that would be helpful to share with our partners, I'm glad to do that. Okay. All right, it seems like we're about meetinged out. So without Bruce, does somebody want to call us adjourned?
So moved.
Thank you, TC. We are adjourned at 3:35.
Thank you all.